Good evening. I'm Dr. Parker. I'm one of the bariatric surgeons at Geisinger Medical Center, bariatric surgery group. So I was going to talk a little bit about bariatric and metabolic surgery, commonly known as weight loss surgery, and we'll get a little bit more, talk a little bit more about that and how it's more than just weight loss surgery and really kind of addresses multiple medical problems. So again, we're going to kind of describe why bariatric surgery is not only helpful in terms of medical weight loss, but is also helpful in treating some of the common problems associated with obesity. And then we'll describe briefly some of the different surgical options available. Obviously, that would be a deeper conversation that you and your physician or surgeon would have if you proceed to go down that route. And then we'll briefly introduce you to some of our surgeons and a little bit about their histories and where they're coming from. And then we'll briefly describe some of the process that you would go through to get to bariatric surgery, as well as some of the care that you would receive afterwards. So again, obesity really affects the entire body in terms of multiple medical problems. We'll hit some of the highlights here, but just that there is multiple sites that obesity can affect. Obviously, the kind of common ones that we would talk about would be heart disease. Obesity is both a risk factor for coronary artery disease, heart attacks, as well as some of the medical problems that obesity can cause are also risk factors for heart disease, such as diabetes, high cholesterol, and high blood pressure. Those are kind of the common things that people think about, but some of the other common medical problems include fatty liver disease, and that's actually the #1 cause of liver failure and cirrhosis nowadays. Is obesity can cause both fatty deposition in your liver, and that ultimately can lead to cirrhosis. Some of the common things that necessarily we don't always think about would be joint disease. And what we start seeing is obesity can increase joint disease and increase the severity of joint disease. And ultimately, people who are at really high BMI can start losing the ability to walk and mobility in general. Obesity is also a known risk factor for multiple different cancers, to include breast cancer, colon cancer, uterine and cervical cancer, as well as the esophagus and pancreas. One of the other kind of common side effects of obesity include the effects on the pulmonary system, to include asthma, sleep apnea, which is commonly associated with morbid obesity, as well as what we'll call just hypoventilation syndrome. And those are all kind of encompassing in terms of lung problems. And then some of the less thought of things. So obesity is a common cause of chronic headaches, as well as a common cause of venous stasis or venous or blood flow problems in the lower legs. So again, this kind of touches on some of the things we just talked about. So some of the medical benefits of bariatric surgery, really beyond just weight loss. One of the big ones would be diabetes. So really, bariatric surgery is really the only known medical procedure that can really cure diabetes. There's certainly medications to improve your blood sugars and improve your diabetes, but really bariatric surgery is the only known really cure for diabetes. And what we see is about 80% of people who are diabetic, their diabetes will resolve in the short term, and more long term, we see up to maybe 50 to 60% of people have long-term resolution or a resolution of their diabetes. In addition, high blood pressure, we see about 67 to 70% of people have improvement or resolution in their high blood pressure. Sleep apnea, which is common in people with obesity. And what we see is about 50% of people who are morbidly obese or would qualify for bariatric surgery have sleep apnea, and that has a high rate of resolution after bariatric surgery, as well as things like reflux. So reflux is commonly associated with obesity, and certain procedures can increase the risk of reflux. So the sleeve, we'll talk a little bit about that. But things like the gastric bypass, for the most part, will completely eliminate reflux. And then just in terms of decreasing obesity, that can improve both cardiac function as well as heart failure, fluid retention. Certainly people with chronic joint disease, it can not only make increase mobility, but as well decrease that joint discomfort and sometimes prevent people from needing joint replacements. And then overall, just an increase in life expectancy. So again, there's different types of bariatric surgeries, and that's, we'll briefly kind of describe some of those, but that's really a conversation that you and your surgeon would have when you meet with them. Roughly, though, we divide procedures into what we describe as restrictive, meaning they just restrict how much intake you can have of food. Some procedures are both restrictive and malabsorptive, meaning not only do they restrict how much food you can take in, but also aid in malabsorption, and that malabsorption can also contribute to significant weight loss. So if you're looking into bariatric surgery, you may have heard about the sleeve gastrectomy. That's one of the more commonly performed bariatric procedures across the country. It is, for the most part, really just a restrictive procedure. So it just restricts how much food you can take in. And it's a fairly simple in terms of what we're doing, in terms of just removing about 80% of the stomach, just to decrease the size of the stomach and restrict that, how much you can take in. And again, the Roux-en-Y gastric bypass is also a fairly common procedure performed across the country. It creates some restrictive in terms of restricting how much food you can take in, but there's also a malabsorptive component. So a lot of times people will have much more successful weight loss, as well as some of the related medical problems with Roux-en-Y gastric bypass. And there are some surgeries that are a little bit more involved, that we tend to reserve for people who are at really high BMIs or have fairly significant medical problems. And those are what we refer to as the BPD or SADI. And again, those would be things we would talk about at your appointment. So again, this is just talking about restrictive versus malabsorptive, and that would be really a deeper conversation that you and your surgeon would have. So obviously, one of the things that we all worry about would be the risks of a surgical procedure. And for the most part, not to say that there aren't risks. Really, with any surgery, there are some risks. But there's quite a few studies that have looked at the risk of bariatric surgery, and what they've found is the risk of bariatric surgery is similar to the risk of having your gallbladder taken out, and the risk of mortality from bariatric surgery is similar to that of gallbladder surgery. So it's overall a relatively safe and commonly performed procedure. So some of the different procedures, so again, gastric bypass, historically, that's probably the most commonly performed procedure. It's, again, what we refer to as restrictive and malabsorptive, meaning it restricts how much food you can take in, but also affects some absorption of that. All these procedures are done either laparoscopically or robotically, meaning they're all through tiny incisions. And what we would expect to see is about 60 to 70% of your excess weight loss. So most patients are fairly successful with the Roux-en-Y gastric bypass in terms of decreasing their weight. In terms of hospital stay, we're generally looking at about 1 night in the hospital. Usually patients can go home the following day. In some really healthy patients that don't have a lot of additional medical problems, potentially they can go home the day of surgery. And then again, complications, those would be certainly things that we would talk about at the time before surgery when you meet with your surgeon. And again, in terms of resolution of medical problems, the Roux-en-Y gastric bypass is fairly effective not only in terms of weight loss, but also fairly effective in terms of treating a lot of those obesity-related medical problems. And then certainly long-term, we will talk pretty extensively about some of the multivitamins and nutritional aspects afterwards, and some of the supplements that you'll need to take. So again, this is the gastric sleeve. For the most part, this is kind of a restrictive only procedure. And again, for the most part, we're just removing roughly about 80% of your stomach. Weight loss is fairly good, maybe not quite to the degree of the gastric bypass, but certainly for select patients, this can be really the procedure of choice. Again, looking at generally 1 night in the hospital. Again, some patients with not a lot of other medical problems could potentially go home the day of. In terms of resolution of medical problems, for some patients with really significant obesity-related medical problems, the sleeve can be helpful, but maybe not quite as helpful as the gastric bypass. And then again, the Biliopancreatic Diversion or the SADI, which are a little bit more complex medical problems. Those are really reserved for certain patients who have either significant amount of weight to lose or have significant medical problems. And that would really be a discussion with your surgeon. So some of the requirements prior to surgery. So all patients will undergo a pathway with our GI nutrition and weight management group. And during that process, they'll screen for certain medical problems. All patients will meet with the nutritionist and mental health experts to make sure they're ready for surgery. Some of the common things that patients can do in advance to help kind of speed things along. One would be if you're smoking or vaping, certainly you would need to stop that. We require at least you would have to stop smoking or vaping at least 2 months prior to surgery. And you would have to have a negative nicotine test. So that's certainly one step you can take, not only to improve your overall health, but also in terms of preparing for surgery. We will have you lose some weight before surgery. They're generally not a huge requirement, but just to show that you're successfully making some changes in both your diet and lifestyle. And then again, we will have everybody see mental health just to make sure we're all kind of on the same page and that you're going to be compliant with our recommendations. And then everybody will see a nutritionist to kind of aid you along that pathway. Again, at the end of our GI nutrition and weight management program, they will again offer you appointment with one of our surgeons. Certainly, if you have a surgeon you would prefer, you can request that at that point, and then we'll refer you on. So our surgical team, so our list of surgeons, so Dr. Petrick is Anthony Petrick. He is our division chief of bariatric and foregut surgery. He went to Georgetown University School of Medicine, as well as his residency training at the University of Georgetown, and did his minimally invasive surgery fellowship in Pittsburgh. Hi, Dr. Parker. I'm the program director of our Bariatric and Foregut Surgery Fellowship. I went to West Virginia University for both undergrad and medical school. I did my residency training in the military, and I came here for my fellowship training. Dr. Obradovic is our research director, and we are all heavily involved in our national organization, and as well as in terms of research. And he is one of our surgeons. He did both his residency training as well as fellowship here at Geisinger Medical Center. Dr. Shaheen is the newest member to our practice. He did medical school in Damascus, did residency at Thomas Jefferson Hospital in Philadelphia, and then just finished his minimally invasive training in California last year. And so we have two groups. One group is here in Danville, and all the surgeons we just discussed are all in our main Danville practice. We all have outreach clinics, so certainly we can send you the links of some of the places that we go to for outreach, and hopefully bring some of that care at least closer to home. We also have a group of surgeons up in the Northeast in Scranton at Geisinger Community Medical Center. Dr. Horsley leads that group. He's the director of bariatric and foregut surgery in Scranton. He did medical school at WVSOM in West Virginia. He did his residency training at Geisinger Wyoming Valley, GWV. As well as his bariatric and foregut fellowship here at Geisinger Medical Center. Dr. Falvo went to Penn State for undergrad as well as Penn State for medical school. She did her general surgery training at Allegheny Health in Pittsburgh and did her fellowship training is here. And then Dr. Mahan also did his residency training at GWV and did his fellowship training here at Geisinger Medical Center as well. After you complete the GI nutrition and weight management pathway, again, they'll refer you to your surgeon. And then certainly we'll talk about the different surgical options as well as some of the risks and benefits of each of those and kind of help you come to a decision of which procedure would be best for you. About 2 weeks before surgery, we'll have you start a pre-surgery diet, which again, we'll go over in clinic. And that really will be kind of the last step before surgery. And then certainly in clinic, we'll go over some of the things you need to bring to the hospital and give you the remainder of kind of the instructions right before surgery. And then we're going to show you a brief video of one of our previous bariatric patients.
Having bariatric surgery is life-changing. Second best thing I've ever done. Best thing I ever done was marry my wife, Wendy. Second best thing I've ever done was have this surgery. And it has changed my life. 5 years before the surgery, I got rushed to the hospital with a very high blood pressure. I was 503 pounds. Shortly after that, I went and saw my doctor. My doctor said to me, "You need to do something. 50 is a possibility, 55 is a pipe dream. You're not going to see your 55th birthday if we don't change something." So they went out and sent out the referral. Geisinger accepted me. I fluctuate between about 230 to 240. I'm very happy there. My doctor's very happy with me there. And that's where I think I'm going to stay for the rest of my life. And honestly, that's a whole lot better than 503. I turned 52 in November, but I feel like I'm 5. I feel like I've gotten a new life because of this surgery. I ran the Syracuse half marathon. When I crossed the finish line at 11 o'clock, it was 87 degrees. It was the hottest day on record in central New York in April. And I just ran my first half marathon. I was crazy. As I crossed the finish line, I went like this. And I just stopped, because I'm just so grateful for the opportunity. Dr. Parker, Dr. Still, all the dietitians, everybody at Geisinger that has had a finger on this. That race then it completely bit me. And at that point, I realized this is what I want to do. I loved running the race. I loved the camaraderie, but I also loved the solitude of the training runs. Getting up at 4 o'clock in the morning, running country roads by my house, just is giving me such a peace. I run with a shirt that on the back of my shirt, it says, from 503 pounds to 13.1 miles. It just shows where I've gone and what my mindset is. I'm grateful. I'm grateful for the opportunity that I can cross a finish line. I'm grateful that I can get up every morning and not have to worry about running out of breath just because I'm stepping down a step to go out of my house. That I am actually out running.
All right, and I think there were a couple questions in the chat that we could address. So the first one is, are there any common side effects after surgery, such as nausea and soreness? Which is a great question. So what we generally tell people is, for the most part, people go home, I would say, relatively pain-free. There will be a little bit of soreness, but most people we send home on just Tylenol, and most people do fairly well with that. So I would say significant pain is a fairly uncommon thing. We also send people home on some nausea medicine, and I would say most people, when they see us back at about 2 weeks, generally report they've taken 1 or 2 doses of that nausea medicine. So I would say that tends not to be a real common problem. I would say the most significant probably kind of side effect afterwards, or difficulty rather, that people have afterwards, is just early on getting down as much fluids as we want them to get down. So generally we say we want you getting down about 64 ounces of fluids afterwards, just to maintain your hydration. And that sometimes can be a little bit challenging for people early on. Most people are able to do that, but it does take kind of constantly reminding yourself and constantly kind of working to make sure you're getting the fluids down. But nausea tends not to be a huge problem. Another question was, how much weight would I need to lose to have the surgery done? So generally what we say is somewhere around 10%. So if you're about 100 pounds overweight, we want you to lose probably about 10 pounds before surgery. That's not a complete disqualification. Like if you're really struggling because of your diabetes, or maybe you have mobility issues, that's not necessarily a complete cutoff, but we try to get about that 10%. And we work with our dietitians and our bariatric medicine physicians to try to get you there. And what we find is people who are successful before surgery tend to be a little bit more successful afterwards. So certainly we'll help you along that journey, but certainly I think there is some benefits to losing some weight beforehand. And then the last question was, typically how long am I off work? So a little bit depends on what you do for work. So people who have more sedentary or administrative jobs, we generally say if you really need to get back to work, you could probably get back at a week. Usually we try to suggest about 2 weeks to most people if they're mostly administrative. Now, if you do more physical labor, then you might need a little bit longer. So if you're really doing kind of physical, particularly like heavy lifting and things like that, generally we'll recommend about 4 weeks off. All right, and I think that was all the questions. Do we want to share the contact? Actually, before we get to there is one other things that we should cover. So obviously one of the newer kind of treatments in terms of medications are the GLP-1 medications, so like Ozempic. And so those certainly can be beneficial for some people. That can be some people can't be successful with that, particularly if there's not a lot of weight they need to lose. But what I would say is bariatric surgery is probably the most effective treatment, and surgery definitely results in better outcomes in terms of weight loss, and limits in terms of long time need for lifetime medications. And then the long term tends to be more cost effective. And I would say for the most part, patients tend to benefit more in the long term in terms of overall health and overall medications.
But this is a contact form that we encourage you to fill out if you're interested in learning more about weight loss surgery and other treatment options at Geisinger. Just want to say thank you very much to Dr. Parker. This is wonderful. And I hope everybody has a great night.
All right, thank you.